Hi, everybody.
Hey, Stephen. All right, can everybody on the phone, if you're on, we're gonna get going here. Just give a quick wave if you can actually hear me. Excellent. Okay, thank you, Stephen. All right, welcome everyone to what is the first virtual community meeting in my career. And here in the city of Redondo Beach, we're gonna try something different. I apologize, of course, for the fact that we have to do it this way, but to keep us all safe, I think this is in everybody's best interest. And what I'd like to do is just kind of start out with a little bit of ground rules for how we'll do this. That way it doesn't get a little bit too crazy here, depending on how many people come in. Right now, everybody is muted. And when you want to talk, you can unmute yourself. But what I'll do is I will start off by calling on a handful of people. And that way they can each talk, and then we'll get to some questions after everybody has spoken. To avoid too many people talking, I will most likely just try to maintain muting everybody except for the person who is speaking. And hopefully we'll see how that works. When we get to the Q&A, over on the right-hand side of your screen are a couple you'll see some buttons like yes, no, and then there's a more area, 3 little dots, and in there is a thumbs up and a thumbs down and a clap. I thought that there was a way to raise your hand. I'm not really seeing that here, but what I would do is if you want to ask a question, you can add something into the chat area. There's a little area where you can type into the chat. You can add a question there, or you can potentially, I guess, hit a thumbs up button, and maybe that'll help me realize you want to ask a question. So we're going to try to figure this out. I apologize for any wonkiness, but this is all new for everyone. So with that said, thank you everyone for being here. Staff, Dr. Keller with the Unified School District, Jacqueline Sun, and Dr. Kim with the Health District. I see Nico Rodriguez is here from Congressman Ted Lieu's office. I appreciate it. Clearly, we are in unprecedented times right now, and everybody is trying to do their best to ensure the safety and security of our residents, our students, our businesses, and we're all trying to figure this out in real time, because on a day-to-day basis, sometimes an hour-to-hour basis, everything is changing. The city manager just put out a new update. That's the 6th update since March 12th. So as you can see, we are trying to roll with the changes here. I will let him get into that and explain it a little bit. But why don't we start there? So Joe, if you are on, why don't you unmute yourself, and you can take over and explain to everybody. Why don't you start with just a little overview of what we did since March 12th, and then where we're at today with the most recent order.
Sure. Thank you, Christian. Thank you for inviting me and our staff to be part of this. We're doing a lot of meetings like this with our own staff and with our own emergency team. But yes, going back to March 12th, that was the day that we as a city declared a local emergency. That was an action that I took as city manager, working in my capacity as Director of Emergency Services. A number of cities have taken similar actions since then. We were one of the first in South Bay. We have an emergency at the national level, the state level, the county level, and without question at the local level. There have been a series of actions that we've taken in Redondo Beach, largely in parallel with what other cities have done. We have shut down our senior centers. We've shut down our 2 libraries. Our after-school programs were shut down in conjunction with school going into remote learning. We have shut down all of our city facilities to the public. We're transitioning our services from in-person, over-the-counter services to email, remote access, and basically focusing on continuity of government. we have all of our actions listed on our webpage, kind of in order from most recent to earliest. As Christian mentioned, there was an order that was issued today by me, working basically in coordination with the team here. We extended a number of closures to include coastal parking areas, park areas, areas that we've seen people not following the rules for social distancing. And these are actions that a number of cities are taking. It's painful to take these actions, but we feel necessary and in the interest of the health and welfare of the community. So that was sent out via a blast through our Everbridge system. Those of you that have signed up for that should have gotten a notice. It will direct you back to our webpage. And we have been in contact with the County of Los Angeles, who is actively evaluating a beach closure countywide. So that will probably be the next major action to happen on a regional basis. But that's a sense of what we've been up to. We've gone into emergency mode. We have employees, a few employees that are working on site, many that are working via remote access. Local government is one of the exemptions in terms of being considered an essential service. So we have people working. We have people working in a different way, but doing our best to deal with this crisis and do our job to protect the community. So with that, I'll turn it back to you.
Okay. All right. Thanks, Joe. Thank you, Vanessa Poster, for letting me know that the raise hand is left of the yes button. So if anybody wants to raise their hand later, that's where you would find it. I'm going to switch over to our Chief of Police. There's been questions out there from residents related to public safety, related to social distancing, what we're doing since they see people on the Esplanade or in different places. You know, what should people do in a time like this? But Keith, would you like to address what what you guys are doing from a public safety perspective, and how the people can help you guys do your job in ensuring everybody stays safe and healthy during this time? All right, Keith might be.
Keith,
Brad. Hey, Brad.
you guys hear me okay?
Yeah. Yes.
Okay.
Keith, are you there or?
I'm here.
Okay, perfect. There you are. Great. Did you catch that at all or no?
I did.
Okay, go ahead.
So first and foremost, obviously we look for voluntary compliance. We've had 100% voluntary compliance with almost everything that we've come in contact with. There have been a few people in the beginning of the first couple of orders that were a little slow to respond. We contacted them and ultimately gained compliance. So the number one thing the community can do for us is listen to the rules, listen to the orders that are coming out, keep updated with those orders as they change. You know, the last thing we want to do is have to use enforcement to enforce these things that everybody knows they should be doing for the public's health. So we're doing lots of education, and you know, we're using as much compassion as we can. What I think is important for the community to know that as everyone's lives have changed, so has policing. We are doing things very, very differently than we were a month ago. The good news is that this police department and this city got on things early. And 2 weeks ago, I think even our own people here at the police department thought that many of the things we were doing were unnecessary, but we're pretty happy that we're in the position we are today. So what we keep telling everybody is act now and we'll know what the results are 2 weeks from now. So I get a lot of questions personally about what are the police department's contingencies? Do we have enough people? What if this and what if that? The community should know that all of those contingencies are in place. There's been drastic changes to our staffing models. We have people broken into teams. We are very, very careful about cross-contamination of those teams should one of our own officers get sick. We have protocols in place for testing of our first responders. We're working closely with the fire department on how we respond to calls, especially those which could involve someone that's infected with COVID-19. You'll see our police officers out on the street with masks on their person, gloves, goggles. They may not have them donned all of the time, but what is different for us now is that we're asking the community more questions. When they call the police, we are going to ask them some questions about, have they traveled? Are they symptomatic? This is before the officers even respond. We also ask for the community's patience because we may be taking reports by phone, where normally you may have seen a police officer come up to your door. If we're able to keep our resources out on the street and visible, I'd prefer to do that and take the report by phone, or you can go onto the city's website, click on the police department link, and do an online report from there. I'll cover this because someone will ask me. Crime stats. Things have changed a lot. Just in the past few weeks, calls for service are down about 43%, arrests are down 45%, and Part 1 crimes are down about 35%. Because that's happening, it doesn't mean that we're lowering the number of staff that are out on the street. Basically, every person that's a sworn peace officer in Redondo Beach is in uniform now. Doesn't matter what their job function is. They're broken into teams, and we've supplemented our patrol staff so that we have high visibility out on the street. Our main focus right now is to be visible, be present, gain voluntary compliance as all of these rules come down, and basically try to keep the community calm. We have all of the personal protective equipment that we need, and what we're doing right now is really focusing on keeping our officers healthy. So the best thing that everybody can do is comply, use a little patience with us if we're taking phone reports, and that our role has changed, as has everybody else's. But we feel pretty good about it. Our officers are very confident, and they love the measures that have been put in place, and we're looking out for their safety. So that's about it. Thank you.
Thank you. All right. I'm gonna just keep moving on here. So next, we're gonna go to Jacqueline Sun and Dr. Kim with the Beach City Health District to hear a little bit about what they're doing, some of the resources that they're able to offer residents, elderly, anybody who might be suffering. And I know there's questions about whether or not there's going to be any testing sites related to the health district. So Jacqueline and Dr. Kim, do you guys want to weigh in?
Sure. Hi, everybody. I'm Jacqueline. I'm with Beach City's Health District. Just wanted to give you a quick update as everyone's lives have kind of changed. I hope everyone's doing well. At the district, we have activated our district operations center in response to COVID-19. That means that all of our resources are directed to community response and how do we serve the community in this really trying time. You may have heard about our assistance referral and information hotline. I can give that number out. That is for anybody who needs any type of assistance. We have people who are answering the phones 7 days a week from 8:30 to 5. That's anything from food delivery, medication pickup. You just need a conversation companion. You need benefits, counseling from our social workers. Direct all of those to our hotline, and that's 310-374-3426, extension 256, and I'll go ahead and add that to the chat so everyone can see it. We have basically deployed some of our staff who have been either at our Center for Health and Fitness or Adventureplex, and they're fielding some of those requests from the community. We've also been connecting with a lot of groups in the community who, thankfully in our South Bay, we have a lot of folks who want to help and volunteer. So we provided some training to make sure that people are safe while they're helping their neighbors. What we're asking folks to do is to look out for each other. as you know, we're sheltering in place and we're safer at home, to make sure that your neighbors have what they need. And there's some protocols that you can practice social distancing, but also be safe. In addition to what we're doing, as Christian mentioned, we're also working on trying to get more accessibility to testing. We know that that's been a huge backlog. And so we're working in partnership with the county, looking at other opportunities with the state, and also looking with our partners and our tenants to increase that. And things are changing day by day. So as more develops, we'll definitely keep everybody in the loop. More testing is coming online. We know that the county, we're tuned into those reports every day. And just fair warning, as more testing becomes available, you're gonna see more positive cases, unfortunately. But I mean, more testing is good, because then people will know who's positive, instead of being around and not knowing. And in addition to our 256 hotline, we're constantly providing information and resources for people to stay healthy while they're safer at home. So that includes videos from our trainers on our Facebook page to do some exercises, and information of how do we integrate our mental health and happiness into safer at home. How do we stay connected with one another while we're still practicing social distancing? So with that, I want to kick it off to Dr. Kim to provide more of the health update from the medical perspective.
All right, Dr. Kim, are you on? All right, doesn't sound like he's on right now, but Dr. Kim, if you are on, then just let us know and we can come back to you always in a little bit. I'll move, what's that?
I see his name in the list of participants. If you can go through there. Maybe
Oh,
you can...
there,
Can you
there
hear me
are.
now?
Okay.
I don't know if you can see.
Oh, yeah, we can hear you now.
Okay.
All right, there you
Yeah,
go.
so sorry, I'm just kind of getting used to this technology. Yeah, so we're following,
We are.
yeah, we're following the numbers very carefully in LA County. And then also I'm on staff at both of our local hospitals. So I'm following their plans in case we get a big surge. But as Jacqueline said, I think we're most important in trying to roll out testing for individuals that may not have symptoms. That way, hopefully, we'll be able to better identify those that might be silent carriers. And I think that's one way that this epidemic can be, or pandemic can be better controlled. Otherwise, I think Jacqueline just covered everything we're doing over at Beach Cities in a stellar manner. As she said, we meet twice a day and once with the LA County Department of Health to follow things along.
Okay. From your perspective, Dr. Kim, is there anything as a physician that you would want to say to residents out there, just in case they may be getting mixed information from news sites or whatnot? And I know people may be doing things differently in other states, but is there anything related to the County Department of Public Health that you think is important to share with people right now, especially as it relates to maybe feeling under the weather? Should they be going to an urgent care? Should they be going to a hospital? Should they just stay at home unless their symptoms worsen? What's the best action for an individual to take? And one thing I keep hearing is that everybody should just pretend that they've already contracted the virus and just stay home and isolate from other people aside from their family and treat it as such. What are your thoughts?
That is the ideal situation, is if you don't have to go anywhere, do stay home. As relatives come into town, I get this question quite often, especially with kids coming home from college. And they're going home to a home that might have an elderly grandparent or something. So those individuals should try to be careful about very close personal contact with their loved ones until they be able to show for about 14 days that they don't have any symptoms. Now, if one should develop symptoms, it's best just to check in with their caregiver, their primary care physician or caregiver, to see if it's warranted that they be tested. And then testing can be arranged for those that are quite ill. Though we're seeing so many other bugs right now. I mean, there's still influenza A and B out there. We have the respiratory syncytial virus, many other things that can masquerade as a, as the Corona-19 virus. So communicate with their caregivers. With their physician, and that's the best way to deal with this right now.
Okay, great. Thank you. Stick around because we may end up having questions from residents that will be in your domain. And I think Dr. Stratton is also on the call as well. So I'll actually, before I go over to the school district, Dr. Stratton, since you are on the call as well, and is there anything from your perspective that Dr. Kim didn't mention that you would like to bring attention to?
No, I think that Dr. Kim basically summarized everything the way it is now. Sorry, I have a frog in my throat. It's not coronavirus. The news coming out today is, I think probably everyone's aware, is that now the United States is #1 in the world with cases, but our mortality rates are not quite as high as other countries have been. As far as anyone knows, the virus has not hit third world countries. It probably has, for example, Africa, but they're not able to detect it as quickly as developed countries. So I would suspect that travel bans will stay in place, that there will be a restriction of travel. I know there was discussion of restricting travel within, for example, California, and restricting domestic air travel, but I don't think that is currently still on the table. The one thing that you're going to start seeing, particularly from local, state, and federal government, is the need for planning on how to basically reintroduce society, community, and economic activity once the coronavirus starts to taper off, and how to monitor for a second wave that could occur which is for many viruses, it often comes in 2 waves. So we're getting to a point now where advanced planning for where to go next is, as everything currently is appearing to be relatively effective. We have to figure out, as with any disaster, how to get into long-term recovery. And that's about it. That's about all I have.
Okay, great. Thank you so much for joining us today. All right, we're gonna switch gears to education. I know a lot of people are functioning as homeschooling educators now, along with the teachers of the Redondo Beach Unified School District who are doing things virtually. Dr. Keller, and then I'll go to Brad afterwards. But Dr. Keller, would you like to kind of weigh in, tell us what's going on with the schools? What's the anticipated closure length right now? Is that changing? And are there any other resources aside from what you're already sharing with your parents that people can look to from you guys?
Can you hear me?
Yes. Hold on. You just disappeared. Okay. Did you mute yourself again? Let's see. Oh, you're okay. There you are.
We good?
Okay. There you go. You're unmuted.
Okay. I'm unmuted. Great. First of all, if you see Kelly, it's not Kelly. That's my wife's name. Hope everyone's well. We want to thank a few people here. I want to thank Joe Hofkin, our city manager, who's reached out to me several times, ensuring that we're synergistic in everything we're doing. Chief of Police, Chief Kauffman, thank you. I was cringing when you were giving the statistics, because my concern, obviously, with all of our kids out there, I'm hoping that small contingent of students sometimes are not spiking stats. So I'm glad our kids are being compliant in the community. Thanks to Chief Metzger as well for from the Redondo Beach Fire Department. His team and my team have worked together in collaboration. And of course, Beach Cities Health District. I want to thank everything they do with us and for our community. Want to let you know schools are closed. LA County, most of LA County schools are closed until essentially May 4th with staff coming back then and then students coming back. Ideally, that's the goal. May 5th, we obviously have custodial staff on site currently, scrubbing, sanitizing, cleaning, high-touch areas, classrooms, desks, all the things that we can using the most aggressive chemicals that we're allowed to use. I have to hand it to our custodial staff. They've been there from the beginning. I want to make it clear, our schools are closed, but kids are learning. We have one-to-one devices with our students. That means every one of our students, the school district provides, thanks to the support of our very kind and generous Redondo Beach community. Every one of our students has a device, a Chromebook or a tablet. And so learning is happening. Our teachers are well prepared. We have a very robust infrastructure. Our board is very supportive in providing this remote learning all the while for the last several years. And so although it's been an increase in learning, of course, not just for our students, but our teachers, because we haven't been this live this often in our history. So this has been new terrain, but I mean it when I say it. Our teachers are the best, and I'm proud of them. The other piece I would share with you, we are continuing to feed students. Right now, it's any student, any family that wishes to pick up a breakfast or lunch Monday through Friday. Our district provides you a breakfast and a lunch. We're going to switch that from currently we do it daily. Next week, it's getting more and more creative on our side to just be more efficient with our staff and our community. We're going to start feeding folks, providing them Monday morning 8 to 11 at Adams Middle School, 8 a.m. to 11 a.m. at Adams Middle School. Monday, you will receive a breakfast and a lunch for Monday, Tuesday, Wednesday. So that'll be 3 days of nutrition for our community. And then on Thursday, you come back between 8 and 11 to Adams and you get your Thursday, Friday breakfast and lunch. Then that starts next week. Tomorrow, regular hours, come on by. And this is not just for free and reduced lunch students. This is for anybody in our community. We are not asking for identification. We're not, we're just drive on by, show us you have kids in the car, you're getting food. And that's how we've been doing it. And that's how we will continue to do it, thanks to our support from the Board of Education. We are, I'm being honest with you, we're preparing, there's a lot of rumor out there. I see Ben Allen's on here. He knows a lot more than probably I'll ever know, but we're preparing for, a return. We want our classrooms impeccable. We want our high touch areas sanitized. We want our teachers to be ready. We want our parents to be ready, but we understand that this could be a moving target. We're obviously realist. We'll obviously support the guidance from the state and LACO. And then the last thing, I really want to emphasize this, we're just a school district. We're not really into the, the more capitalist notion of community, but we are advocating everywhere you see, every time you hear us speak, we're saying support your local small Redondo Beach business. So we're pushing that out hard. It's on our Instagram page. It is on our call outs, our messages to the community, because this is school community. The lines are broken. We're all part of something bigger. So with that, I'll turn it over to my boss, Board President Brad Waller.
Howdy. I don't really have a whole lot to add to that. I do a couple of these conferences a day, so that's why I'm adept at knowing who's muted and where things are. But, we appreciate, people's patience and ask for as much as possible. The big thing is this was thrust upon us with basically no notice. And we are doing it as best we can, coming in as fast as possible with figuring out how best to get education to our kids. And as time goes on, it will get better and better and better. I've seen video chats, I've seen kindergarten kids on devices talking to their teachers and things like that. So we're figuring it out. If there are any issues, we are here, we're available. Ask us questions, start off being nice. It's a whole lot nicer when I get an email or something like that where somebody says, hey, what's going on with this, as opposed to you're doing it all wrong. So, appreciate that we're doing our best, and there are things that might get overlooked. So let us know, and we'll do what we can to take care of it. And we're here for, we're parents in this district for the most part. My daughter's not, she's stuck in Colorado. But, on my own block, I've got 2 of our staff members from Redondo. So, I see kids, staff members, everything just, feet from my door at all times. So I'm hearing a lot, getting feedback, and hopefully improving things.
Great. Yeah, I want to echo what Brad's saying there, because I think whether you're with the city, the school district, the health district, or even if you're one of our state elected officials, everybody's trying to figure this out for the first time. This is, as I said at the head of this is kind of unprecedented. So, so be patient. Everybody's trying to find the answers for residents in as fast as real time as possible. Stephen, I wanted to just follow up with a question, and you may not be able to answer it. It may be too soon, but somebody asked me, what about, the kids who are going to matriculate out, from primary school to junior high, or junior high to high school, or high school out? If for some reason you guys had to extend, beyond closure right now, do you have, are you guys working on protocols for if that kind of worst case scenario happens, or is that something that you will just communicate to people as you guys figure it out?
If you're referring to, moving forward to the next grade level, yes, every indication we have before us is students will not be penalized for lack of school days in seat in a classroom. I remind you, because we are beautifully remotely teaching, we're lucky. We're one of the lucky districts, I will tell you. So there has not been a compromise of instruction. We're one of the lucky ones, but I will tell you, if you go to many places throughout this great state, a lot of school districts are creating old school, how a lot of us here would learn on independent study. You would just get a large packet, a bunch of books, and you'd go home. But this is real time, just as we're doing it here. It's just as the students are getting it in their classroom, and it's a great sight to see. But unfortunately, equity is not something that is throughout the state. So this is something I think the state will grapple with, and understandably, we're lucky.
Oh, great. All right, thank you. I'm going to go to Senator Allen next, but before I do, I see Fire Chief Metzger has popped in. Chief Metzger, is there anything you want to share with people from the perspective of the first responders on your end? Chief Kauffman has already talked about public safety from the police standpoint, but I don't know if there are people who clearly are worried about the firemen and women who are out there responding to calls. Is there anything that you want to tell them about your procedures or what they're doing in response to calls for action?
Well, yes, and thank you very much for the opportunity. We have changed the way that we're operating, but it is done in order to keep the public safe and keep our responders safe too. Typically, instead of sending an entire crew to go into a structure to meet with the patient and treat the patient collectively, we suit up one person who will be wearing a complete body substance isolation garb or equipment. And it's a 4-piece set. And it looks a lot like a Class C hazmat response, but it's designed to protect their eyes, their hands, their respiratory system, keep them from sustaining spatter and that kind of great stuff. And that one person will go inside, make the initial assessment, determine the treatment that the patient needs, and if he needs help, the caregiver, he'll radio back out and we'll send in whatever additional resources might be necessary. In the vast majority of cases, we're finding that the single caregiver is enough to take care of business. And then once the ambulance comes, if in fact the patient is going to be transported off scene, their attendants will also come in appropriately protected and attired to assist in the transport of the patient. The rest of our crew remains outdoors, and that's designed to keep them from potential exposure, unreasonable exposure to the virus or to any other hazards. And this manner of operating was something that we put in place about 2 weeks ago, and it seems to be working very well for us. It's also helping us to conserve some of our important resources that are becoming increasingly difficult to come by, especially the respiratory masks, what you've heard as the N95 masks. So right now that's working well. You heard Chief Kauffman allude to the fact that they're actually experiencing a reduction, a pretty significant reduction in call volume. We are seeing a downtick in our calls as well. I'm not prepared to explain why that is. We really don't know, but we are, nevertheless, some days are higher, some days are not. And, but by and large, we appear to have trended downward to some degree. But we are here to provide ongoing continuous service to the same high levels that the community has been enjoying. And the thing that we are hoping for is that the virus does not adversely impact the fire department to a point where staffing becomes a problem. We believe that taking the approach that we're taking helps to safeguard that. And that's about all I need to say about that at this point.
Okay, great. Thank you.
Thank you.
And I just want to say, of course, thank you to everybody else who has spoken as well. You are all providing a service that is going above and beyond right now. So I'm going to go over to Senator Ben Allen, who I see is on the call. I'll unmute you right now, Senator Allen. Hey, there you are.
Yeah.
And you got your hat on for opening day.
Yeah,
So,
I know. It was a melancholic decision, but
yeah. So what can you tell us? You know, a lot of the questions I get sometimes here at the local level actually are far out of our jurisdiction. You know, what can we do to help small businesses? What can we do to help with rents and evictions and mortgages? And I keep trying to explain to people that you guys at the state level and at the federal level are trying to figure out some of those broader questions and concerns that affect us economically. Are you able to share anything about what's going on from an emergency perspective, you know, related to the Capitol?
Yes.
And great.
Yeah, well, let me just let me give a little overview from my perspective about what's been happening at the state level, where we have our Department of Public Health, our Health and Human Services Agency, and of course the Governor's Office of Emergency Services, which have been at the heart of the state's response to the current crisis. You know, I like to think that the governor was able to take decisive action, certainly sooner than the folks in Washington. About 3 weeks ago, the governor declared a state of emergency, and he issued the first in what's now a long series of executive orders that have made exceptions to state law in order to help us prepare for and address the growing pandemic. And so now he issues an executive order almost every day. Obviously, the most notable one is the one that we all know about, staying at home, the stay-at-home order that was enacted last Thursday on the 19th. But it was also preceded by directives that do a whole bunch of things. So there's obviously ordering mass gatherings to be postponed or canceled, directing bars and clubs to close, restaurants to remain open only for drive-through or pickup delivery, removing the waiting period for unemployment and disability insurance, which is certainly an important one for people who have lost their jobs, providing a 90-day extension to file California tax returns, authorizing local governments to halt evictions for renters and homeowners, permitting local and state legislative bodies to hold meetings via conference calls while they can still meet the state, while still meeting the state transparency requirements, halting intake of inmates and youth into the state's 35 prisons and 4 youth correctional facilities, at least those that don't pose a danger to the public, and then also putting the National Guard on alert. Just yesterday, the governor had a big press conference to announce that he secured a commitment from all of the major national banks, except for Bank of America, and I'll talk about that in a second, but all state banks as well, and credit unions, to provide a 90-day mortgage forbearance for California homeowners who can provide documentation that they've been economically impacted by the virus. Bank of America has agreed to a 30-day mortgage forbearance, but I think there's a hope that they'll feel some pressure and join their fellow banks and go up to 90 days, which I think will make a big difference for people. It doesn't mean that you won't be on the hook for paying your mortgage down the line, but it certainly means that you'll have some flexibility if you've lost your job or you've had a serious diminution in income as a result of the crisis. The legislative branch has been trying to figure out how best to continue functioning during the crisis. It's made it especially challenging due to the fact that as a body we're supposed to be very directly accessible to the public, and our deliberations and all of our voting have always happened in a publicly accessible shared physical space. So we're trying to figure out whether we can conduct online hearings and remote voting. But as that's going on, the Senate has really kind of focused its legislative committee apparatus to restructure to respond to COVID specific issues. We have these new Senate policy pods that they're producing on a week. It's now a weekly document they're sending out to us with over 70 pages long, detailing information that our offices can use to help constituents and stakeholders who have questions about any issue under the sun, from schools to safety of drinking water, utility shutoffs, mortgages, property taxes, changes to alcohol and marijuana laws, whatever they may be. And the legislators are also in pretty close contact with the Governor's Office of Emergency Services, passing on information. We're oftentimes getting offers from people who want to help, factories that want to produce medical equipment or supplies, everything from as complicated as ventilators right the way over to masks or medical apparel. So right before we went on recess until April, the legislature approved over $1 billion in state money as a surge fund for a variety of services. And most of it's going to go toward trying to improve our healthcare system's ability to respond to the virus, which is, of course, our biggest fear right now, is the extent to which our system is going to be able to help to handle a big uptick in people. And we all seen the disaster that's taken place in Italy. But we also were able to pass a bill that's providing some additional funding for our schools to help them tide over. And I know our school board member, superintendent are here, and I know that was important for them. There's been a lot of focus on trying to ready our network of emergency rooms and hospitals for the expected surge in patients. Like so many other states, given the lack of available and widespread testing in the state, we can really only estimate the current number of infected people within the state right now. I know that we just have passed China as a nation. We now have more confirmed cases of coronavirus, at least more than reported. So who knows what the real numbers are in China, but at least our real reported numbers have now exceeded those of China. Johns Hopkins just came out with a report showing that we're now over 82,000 nationally. In California, they've tested nearly 67,000 people. The numbers today indicate that 3,718 have tested positive. Our top medical advisor just said yesterday that our cases in the state have continued to double every 3 to 4 days. And so we're really hoping so desperately to try to flatten this curve. I know it's something that everyone on the call should know about. But we're also really trying to work hard to put in place a medical infrastructure to help address the crisis. So Seton Hospital in Daly City is now operational as a direct COVID response center. St. Vincent's in Los Angeles, we're trying to get online. California Pacific Medical Center in San Francisco, in the Bay Area, the USS Mercy off the coast in LA. So that's been a part of the work. We've also been trying to get masks out. I think we've now distributed something like 25 million N95 masks, 100 million more ordered. And California is now continuing to work really hard to try to secure additional personal protective equipment for those folks who are battling COVID on the front lines. So that's everything from our first responders we heard from here, folks in the healthcare industry, et cetera. We've also been working on education. I mean, this is when you get a sense of how many things that people rely on the state government. So our state superintendent of public instruction and the California Department of Education provided new guidance and criteria on distance learning, independent study, school meal delivery, accommodations for students with disabilities, and support for parents in securing childcare and supervision. Certainly, we can make sure that webinar was made available. I know that our folks from the school district have access to that, but we can make that accessible to everyone if they're interested in that. The state's also taken a number of other measures, closing down state park parking lots because people were unfortunately using this as an opportunity to recreate in a manner that was not practicing social distancing, closing select parks, unfortunately. Now, as a result of, we've obviously been watching the situation in Washington very closely, and they've now, it looks like they're very close to passing this enormous $2 trillion package. It looks like, just from the state block grant portion alone, California is going to receive about $10 billion, so that, about $5.5 billion will go to the state itself, and the rest are going to be distributed out to cities and counties. And there's going to be some quite a bit additional money as well that we'll hopefully be able to use for various things. A lot of that will go toward trying to shore up our unemployment insurance system. That has become an enormous problem. Our system, it was just not built for the kind of enormous sudden spike in need. And so that's something that we've been having to spend some time working on as well. So I know LA County, I think, has reported, I think we're now at like 1,000, 1,200 or so, something like that. Manhattan Beach and Hermosa Beach are reporting 21 cases. I think Redondo's now at 20. So something like nearly 10,000 people have been tested in the county, and with a 10% positive rate. Now that's, of course, very high, but it makes sense because there's been such little access to tests. So people who are really sick are the people who are experiencing some symptoms or think there's some reason to get tested are the ones who are getting tested typically. So it explains why there's a this high positive rate. And I know that you probably already know as well that just today, LA County public health officials announced that the convention center is going to be used for the quarantine and isolation of COVID-19 patients who have been released from hospitals and who do not need treatment but could still be contagious. So that's going to be good. The response locally at the county level has been, there's so many tiers to this. LAUSD has been able to get free grab-and-go meals from food centers across the city. I know there's been similar efforts happening in the South Bay. Oh, it's my baby here. So he's 17 months old and just got out of the bath, so he's very excited. We've been, the county's been delivering meals for seniors and all over the county. Small business and nonprofits in LA County are now eligible for low-interest loans as part of the Economic Injury Disaster Loan Program, which is providing small businesses with working capital loans of up to $2 million a pop that can provide vital economic support to small businesses to help overcome the temporary loss of revenue that they're experiencing. Our counties pulled together to offer virtual workouts, ebooks, virtual story hours for kids through the library, virtual museum tours at LACMA, services from the Department of Mental Health for those who may be feeling anxious during these times. So there's a lot going on. It's a crazy time. I know we're all worried about light, at the end of the tunnel. And just earlier this week, Governor Newsom said that we ought to be expecting at least 8 to 12 weeks before we can resume to real normalcy. And that's certainly a distressing thing for those of us who are, in very close quarters with our families and really trying to make everything work. But it's ultimately that uncertainty that I think makes our community's response that much more impressive. The law enforcement folks talked about the drop in crime, the fact that even the fire calls have dropped considerably, and all the people who've been stepping up in the healthcare space. It's been really impressive. So anyway, I'm happy to talk shop about unemployment insurance. That's certainly been a big issue too. We've now processed, I think, 187,000 unemployment insurance claims just this last week alone. 1 million Californians have filed claims. That is a huge number of folks to have to process. And certainly right now, I am personally very worried about the technological infrastructure being up to the task, especially as more and more people are going to be filing. Weekly applications now are 9 times higher than they were at the peak of the Great Recession. So that just goes to show what a serious situation we're in. They've now adjusted their eligibility requirements at EDD, which allows for the auto processing of a large number of claims in the system. So starting tomorrow, applicants just have to check a coronavirus box in their online application, which will help to streamline the process. Their staff are working around the clock, and it's an all hands on deck approach right now where they really have everyone possible working on this issue. But we're certainly, going to need this extra money from the federal government to help to shore up our unemployment insurance system. This is one of the many infrastructural challenges that we're facing right now that certainly are keeping a lot of us up at night. So that was probably took up way too much time, but I thought maybe, it would be good for folks to just hear a little bit about what is happening at the state and county levels.
No, I think everybody appreciates that. For some of the information you were giving out, say,
Christian,
go ahead.
I'm so sorry. One thing to say, we have certainly closed down our office, our district office in Redondo Beach, so as to practice a social distancing. But I do want to let people know that our office is open for business. Everyone on my staff is working full time, and we are rolling the calls to the staff, and we're always checking our messages as well. So our staff number, our district office number is 310-318-6994, and we can post it on the chat as well. Just to give you a sense, I've got 4 staffers, both in Sacramento and Los Angeles, who are even on this call right now. We really want to make sure that we're being responsive to people in this crisis, because I know this is where people need government to be responsive to them and be available to them more than any other time. And so I just want you to know that our office is absolutely open for business as we are practicing social distancing.
No, I appreciate that. Some of the things you were talking about, do you have a page on your website, or are there other website pages that you want to direct people to as it relates to either unemployment or the small business loans? Where's the best place for people to go get ongoing up-to-date information?
So we've got so on our website, we have a link to COVID-19 resources. And our website is SD26, so Senate District 26, sd26.senate.ca.gov. Senate.ca is in California.gov government. So sd26.senate.ca.gov. And right there on the site, there's a big link where we've listed out a lot of COVID-19 resources. And if those aren't enough, or you need more additional information, just give us a call, or you can shoot us an email at senator.allen@senate.ca.gov, and we'll make sure to get back to you.
Okay, and you'll if you or Sam or Alina will add that stuff into the chat as well, then people can
Yeah, Lily. In fact, I just got it. So Lily is literally posting our phone number and site address in the chat with the COVID-19 resource list. In fact, she just posted right there.
Oh, fantastic. Well, thank you. I really appreciate you taking the time to be here today.
Oh, my pleasure. I'm glad we have so many people on the call.
Yeah. I'm gonna, before we move on to questions here, I just want to ask, I know Jennifer Lamarque from Janice Hahn's office is on, and Nico Rodriguez from Congressman Ted Blue's office. I don't know if Andrew DeBlock is here from Al Marisucci's office, but if anybody wanted to weigh in with any information from their side, please feel free to do so now. Nico, I see you there. Yeah.
Yeah, unless Jen wants to get on first, happy to get first. But, yeah, I'm happy to get on here. I also have Daisy Paniagua Uribe, who's our Redondo field rep, also on this. So thanks, everyone. Thanks again, Councilman, for having me here. Unfortunately, Congressman couldn't be on tonight's call, but he said he's definitely down to do one in the near future. Just for basic local focus right now, so we, as the Senator Allen's office mentioned, we as well are practicing social distancing. So our Manhattan Beach by appointment office and our LA office are closed through the wonders of our new house telephone system and some new technology. We're able to get all phone calls routed to us. So we're working, 8:30 to 6 each day, primarily focused on responding to calls from constituents about a number of issues, whether they're local, state, or federal. And then obviously trying to focus primarily on constituent services. So we're doing quite a bit of constituent casework right now. We have a number of people coming to us for the normal things they would typically ask. Social Security assistance, maybe some IRS assistance, immigration assistance. The big bulk of what we're seeing right now are a lot of our constituents who are stuck abroad. So we've been working closely with the U.S. State Department to try to get our constituents back into the country. In fact, the congressman was just on a conference call with the State Department, specifically regarding the country of Peru. We have a number of constituents stuck there, talking to the State Department about how to get constituents back. So we're operating like that. Our field team and myself are proactively reaching out to all of our cities, including Redondo Beach, and with key stakeholders in our district. And then, of course, our partners in the county, the state legislature, and the U.S. Senate, and our neighboring congressional offices. So our goal is to try to filter a lot of this stuff. I think all of us are getting calls from people willing to donate materials, medical supplies, et cetera. And so we're trying to filter that to all of the local and state entities that have been set up by Cal OES or the Department of Public Health. And to try to make sure that we're answering every concern a constituent has. On the broader front, as you're all aware, we have a stimulus bill that is likely going to be voted on in the House, on the House floor, probably around 8 or 9 a.m. tomorrow morning. So that will include a lot of the key things that we need at this time. Obviously, that's going to be cash payments to a significant portion of the U.S. population. That will include reimbursement, I think up to $150 billion is what's being proposed right now just for hospitals, and a sizable reimbursement and assistance fund for the states. But then there are going to be significant other things, investments in telehealth, investments in rental assistance. There will be some money for rental assistance likely in this, more money to help states and small business recover from this. I know there's a paycheck protection program that is going to provide sizable amount of money for small businesses. And then of course, key part, funding and grants for first responders who are basically our soldiers at the front lines of trying to fight this virus. So expect that likely to be voted on tomorrow. Key things for you all to know, and I'll make sure to post this on the chat, are just key details. We do have a webpage specifically dedicated to COVID-19. We are working on a district resource guide that will be kind of a living document of everything people should know regarding local orders, local resources, and assistance to everything that we handle at the federal level, whether that's the delay in filing your taxes in July, to assistance with passport replacement, to potential resources that could be available as it relates to jobs and unemployment insurance. So we're going to work on trying to introduce that, and I'll make sure to put that down. You can call us at our district office, and I'll put that down as well on the chat. You will get one of us. Each of us has an app on our phone that receives phone calls automatically. And appreciate the time. Please do reach out to us if you need any assistance, even if it's not a federal matter. We're happy to figure it out. Thank you.
Thanks, Nico.
Yeah.
All right. Jennifer, did you want to add anything from the county level, or? And don't feel like you have to. All right. Well, so why don't we? I see we have some questions coming in here. So let me see. First question I see is, can I ride my bike or walk alone down the Strand? Joe or Keith, I don't know if one of you wants to address that with the new order that you've just put out.
So if it's the walkway, the concrete walkway on the beach, right now that's open. But if it's the sidewalk above on the Esplanade, that will be closed as of midnight tonight. Stand by for an announcement from the county. We're anticipating some action related to the status of the beach, potential closure, which would affect the Strand.
Okay. And so the recommendation would be for people just to go walking through their neighborhood, maintaining a safe distance between you and anybody else, right?
That's correct.
Okay. All right. Next question here, and I don't really know if anybody has this answer, but how is the Kensington Assisted Living Facility doing, the residents and the staff? do we have, I know we've had some calls there for emergency medical services, but do we have any updates that are able to be shared, or is that something that would have to come directly from Kensington themselves?
Well, let me weigh in on that, if I may. The Kensington is receiving probably daily interaction with the fire department, not necessarily in our official capacity making runs, but we've made a lot of outreach there to make sure, at least initially, that they understood what the expectation was for them, and if they had any questions or concerns related to how they should be interacting either with their residents in terms of a medical emergency under these circumstances, or where to get good, useful, reliable information. We've done our best to try to steer them in that direction. We think they're on a good path now, and I've not heard of any significant issues that have come up there recently. So, but they are invited to call us at any time, and we will make sure somebody goes out there and tries to address whatever needs that they have.
Thank you, Chief.
Sure.
Okay. Ben, this is a question for you from someone. It says, ask about gig workers and those not getting regular paychecks. It's a little open-ended, but. He may have stepped away. I'll come back to that one for Senator Allen. Let's see. Okay. People are wanting to know why you're wearing an A's hat there, Nico. Nico, I think you're from up north, aren't you?
No, actually, I grew up in the on a small farm in Fresno County, so it's Giants territory, and I despise the Giants, and I love the A's, but I always follow the Dodgers.
Music to Ben Allen's ears, yeah.
Exactly. I remember Oral Hershiser, Eddie Murray, Fernando Valenzuela. So, and I actually live pretty close to Dodger Stadium, so I go pretty often.
Oh, good. All right, let's see. It's amazing how much chatter there is about that. The number from, somebody was asking about the number of infected from the South Bay, how many have died. Does anybody have the most recent county stats right now? I know we were just shy of 300 yesterday, but.
I have the
All right.
stats from today.
Okay.
So 421 new cases in LA County today. That brings us up to 1,216 cases in LA County, 21 deaths. They don't report where the deaths come from in the South Bay. In the beach cities, there were, I know that there are 20 cases in Redondo, which was quite a jump from yesterday. I think 20 some odd in Hermosa and Manhattan as well. I see the question about where to get the statistics on Redondo specifically. Every day, the County Department of Public Health has a 12:30 briefing. You can go to the Facebook page for LA County at 12:30, and then after that, they have a press release, and it gives you the numbers for the day as well as the breakdown based on geographic area.
Okay, so the best place to get updates is from the County Department of Public Health at their daily 12:30 press conference.
And also to sign up for their emails, because they send out their press releases daily.
Okay.
By the way,
Somebody
Christian,
else was going to jump in.
Christian, the best information I have on South Bay deaths is two, one in Gardena, one in Hermosa Beach, but that's unofficial. So I don't, but that's my best understanding too.
Okay, thank you.
And nothing in Redondo that we're aware of.
Okay. This question is for Nico. Is there anywhere one can get a marriage license? All offices that she has called have been closed.
Yeah, so I saw Vanessa's question. So it's my understanding, and I know this because I got married about year and a half ago, that generally it's done, marriage licenses are procured and you apply for them at the county registrar's office, but I think the county's closed all those. And then I think that the state has a state agency that sort of manages things at the state level, but all the offices will be closed. Just email me. I put my email address on the feed, or you can call our office. And then I think either us or Supervisor Hahn or Senator Allen's office probably can answer the question and try to figure out, what's the workaround that might exist for someone to do the things that they need to do to apply for the marriage license, pay the fees, kind of as we're doing this social distancing.
Okay, great. This question, I'm going to try to, it's a bit long here, so I'm just going to ask, and it may come back to the same answer Jacqueline just provided us, but where are the actual epidemiological statistics that all this is based on, the closures, lockdowns, safer at home? Where would one find that? Is that from the Department of Public Health, or is that from the State Department of Public Health? What should people be relying on as being, the factual data out there?
I would direct folks to the County Department of Public Health or the State Department of Public Health. CDC, I guess it just depends on what level of information you're trying to get. There's a lot of information that's coming out a lot of different times. So make sure that they're reputable sources, like one of your departments of public health or the CDC. Okay.
Thanks, Jacqueline. Somebody's here asking a question about when they try to log on to Alert South Bay, their software is warning them of malware. I'll just ask Karen, who's sending that question, send me an email directly, and then I'll forward that off to see if we can get an answer for you, because I don't think there's anybody on the call here that may be able to assist with that one. Scrolling through here. This is a question from Laura. She says, what's the best place to go to volunteer to help, especially for confined elderly who may need help shopping? Is that, Jacqueline, can they come, or can people who want to volunteer for the health district contact you guys at a different line than the one you're providing for people asking for help?
Yeah, they could definitely call the same line to plug in. We've gotten a lot of requests from different organizations throughout the community offering help. We also have ways that people can kind of plug in their own neighborhoods. I think that if everyone's taking care of their own neighborhoods, it kind of lessens the load for everybody. So some of the advice is just neighbors taking care of neighbors. Reach out for folks that you know in your area who might need help, and maybe that's your caseload. So. But yeah, folks who want to plug in can definitely call our hotline number that I mentioned earlier that's in this chat, and we can add you to our volunteer list. Okay,
great. Thank you.
And Christian,
yeah, go ahead.
I should just say that the state there's a volunteers site that we'll post right now to give people broader opportunities for volunteering if they want to do things. I mean, obviously, if people want to do medical related stuff, that is incredible. There's also opportunities for people who want to work in food distribution, lots of those opportunities as well that are out there. And so we'll get that posted on the chat.
Fantastic. Great. Some message from Mary Welch Klein. She says, we are seniors, problem getting food without multiple unsuccessful trips to different stores. I don't know of any resources or grocery stores that are delivering at home. I tried the sites, but they are shut down. Again, I think, Jacqueline, you guys at the health district, are you only working with Blue Zone stores, or are you also putting out resources related to the local grocery stores, what times they're open? I know some of them have started to have senior hours only in the morning. Where can somebody get information related to that? And then again, just they can use the phone to use your resources, your volunteers, to help them pick up stuff, right?
Right. So for this person specifically, if you're having an issue, I would urge you to contact our helpline. We have volunteers that are running errands who can pick up things for you at different stores. It doesn't have to be Blue Zone stores, can pick up your medications. I know that certain stores are doing senior hours, but at the same time, we don't want our seniors and those who are vulnerable to be out there and putting themselves at risk any more than they should. So if they feel like they're at risk and don't want to go out to the grocery stores, we urge people to stay at home. Call us and we'll be able to get you what you need.
Okay, thank you. This is a question from Mark. I think this is for either Dr. Kim or Dr. Stratton probably. It says, how confident do you feel that 6 feet is a safe social distance? I see evidence that COVID-19 can hang out in the air. Could it carry in the outside air? Do either of you want to address that aspect from a...
I'll go ahead and take that one. The 6 feet is based on actual data that comes from influenza, where it's been shown that under 3 feet, the influenza virus is easily spread. So to be quite honest, the 6 foot length is doubling the known virus length, which is has already been well established with lots of different studies. The COVID virus cannot really hang out in the air, and it depends on whether you're in a closed space, an open space, how big the space is, and what ventilation is there with regard to infectivity with just air. The important thing is that studies just came out within the last 48 hours that show the COVID virus is actually viable or still infectious beyond 48 hours, maybe up to 72 hours on certain surfaces like tabletops and other types of surfaces like that. So the 6 feet's important, but it's arbitrary based on influenza virus transmission distance. And the more important thing with this virus is its length of time that it stays viable or alive on surfaces. So cleaning and real attention to maintaining clean surfaces is really very important. And I'll let Dr. Kim add to that if you'd like.
Dr. Kim, did you want to add anything to that, or?
Yeah, I was just trying to unmute. Yeah, I think what Dr. Stratton says is perfect. The other thing about these surfaces that can harbor the COVID-19 virus is that when you touch them, it gets on your hands, and then if you touch your face or your nose or your eyes, that's how much of these infections are being picked up. So it's most important to recognize that hand washing for at least 20 seconds with soap and water is most important, and wiping down the surfaces, as Dr. Stratton already said. I think that's all I need to add there. Thank you.
No, thank you. Yeah, I found hand washing to become a bit of a meditative process right now. There's a question here from Marianne, my neighbor up the street. She says, what exactly does it mean if a person tests positive? Do all people who test positive need to go to the hospital? I know my wife works in a local ER, and they're not necessarily even testing people at the hospitals right now. But Dr. Stratton or Dr. Kim, do you want to try to address that question?
I'll take that if you don't mind, Sam. I think anybody that tests positive will probably be sent home if you go to the hospital. Only those that are ill with evidence of respiratory distress are admitted. There's 3 phases of this disease, or 3 different presentations. There's a mild disease that lasts about 5 to 7 days, and then the virus can still be transmitted from the healed person, so to speak, for a couple of more days. Then the next crowd, it's the same thing, but they might have some lung infections, and it goes on for about 10 days plus. The last group are those that get sick. They're pretty ill, 5 to 7 days, they're holding their own, and then they develop acute respiratory distress syndrome and need to be on a respirator. The group that we see that most is the 65 and older, but you're seeing some cases that are younger, much younger. 32-year-old recently, and I think a 17-year-old. I don't know if that's yet been determined whether he had coronavirus or not, but we're seeing younger folks as well. When it comes to the infective range, the 18 to 64 are where we're seeing most of our cases, but most of the deaths are 65 and over. I hope that's helpful.
I think that pretty much answered the question. Yeah, I appreciate that. Question from Lucy asking if we're going to be doing these community meetings weekly. I'd love to. I don't know that I could get everybody back in. Everybody is in these types of meetings all the time. But what we will do, there is a council meeting next Tuesday, so that'll be live streamed through both our two cable channels that carry it. It's going to be virtual like this as well. And we'll try to figure out ways to get more information out. So I can't answer that if I'll do it weekly right now, but I'll definitely try to do something again if other people are available to answer questions. Councilwoman MD says, thank you to the Health District for donating to the Redondo Beach Salvation Army for their Meals on Wheels program. Chief Kauffman has put a message here. If you want to get alerts from our Everbridge system, you just need to use your cell phone, text alert SB, that's alert, ALERT-SB, and you text that to 888-777. That's also in the chat area for those of you who are on the Zoom call right now. Let's see.
Hey, Christian.
Yes, go ahead, Ben.
I understand I was helping put the baby to bed when there was a question about gig workers.
Yes.
And employment. So the answer is we don't know yet. EDD is having to decide whether they are being misclassified. They're actually looking at the issue right now. It's my understanding that the labor commissioner makes a determination and goes after the business for the money. But there was a really interesting, for anybody who's interested in unemployment issues and either for themselves or for their work, Cal Matters did a great live stream today on this topic on YouTube, and we'll make, I don't know if Lily, if you could try to get that posted on the chat as well so people can watch that. But the answer is on the gig worker question is that it's yet to be determined, but they are encouraging folks who are in the gig economy to apply, and we'll see where this goes. But let's get that link posted to the chat so people can watch it if they're interested in the topic.
Okay, great, thank you. All right, someone here is saying to look for more ways for public areas that can be used for social distancing, that they are therapeutic, and that the president states we will be open for business by Easter. I'm not sure anybody here feels confident about that statement, but what I will say is I think in a best case scenario, I know myself, yes, it'd be wonderful to keep the beaches and the Strand and stuff open. We just had a situation this past weekend where there was such an influx of people that it clearly wasn't safe. And even if people were wanting to practice social distancing, they had to remove themselves from that area. So maybe as more people kind of stay safer at home right now and get used to walking around their neighborhoods, you know, maybe those things can lighten up over time, but we're just going to have to play it by ear right now. From our perspective at the city level, and I'm sure our other municipalities in the county are thinking about this as well, we just want to make sure that you as a resident or a business owner are staying safe and are not necessarily unnecessarily being subjected to other people who may not be taking the same precautions. There's a question for Dr. Keller related. This is not really COVID related, but it says, why are the schools getting 5G installed right now? Stephen, I don't know if you want to address that or.
I'm happy to. The answer is we are not. Thank you.
Okay, there we go. Jacqueline, okay, here, you've already, the phone number for the beach cities that Jacqueline mentioned, again, it's here in the chat area. It's 310-374-3426, and that's extension 256. And if anybody needs that, I'm assuming it's also on their website, but it'll be here on the chat and the live stream, which will be embedded on Facebook, Twitter, and YouTube. Let's see. Okay. At this point, there's no more questions in the chat area. We have about another 11 minutes until the meeting's over. If somebody has a question, feel free to unmute yourself, ask your question, and then mute yourself, and we'll let the person answer it that you're addressing it to.
Hi, it's Lily. I work for Senator Allen, and I'm also a resident of North Redondo. And I'm just curious, I don't know who would be best to field this question. It's fairly general, but we've noticed a lot lately in our neighborhood, at least, that there's a lot of construction continuing, a lot of gardening continuing. And I'm just wondering if that's something that is permissible under local ordinances, or if that's inappropriate, or how we should go about handling that.
Okay, sure. Joe or Brandy, do you guys want to address that?
Yeah, I can field that. I'm the Director of Community Development, Brandy Forbes. In both the state order and the county order for essential businesses, construction falls under that. Initially, it was construction of housing, and that was expanded to include construction of commercial, office, and industrial and housing. So that is, it is allowed. However, they are supposed to comply with I think there are 4 requirements under the county order, including they have to do social distancing. They have to have either a hand washing station or hand sanitizer on site. They have to do effective cleaning of the site in areas where they're, they're all using certain areas or tools, and they have to post a sign about those requirements. So we had notified all of our contractors at the beginning of this week when that was first coming into effect of that requirement. We provided them with what signage they need to be posting. Certainly, and not all of them have complied. We have had some people reach out to us with photos of not having the 6-foot distancing. I think that's probably the bigger, the more visible non-compliance. We are addressing that quickly with the contractor, and if they can demonstrate, it's really educational. I think the chief had mentioned this at the very beginning of the meeting, getting out there and making sure people are aware what the order is. Contractors may say, oh, we're essential, so we can just stay open, and not realize they still have to follow these rules. So we're making sure that they are aware of it. If they can demonstrate to us that they are in compliance after we've notified them, and it has to be in a very quick turnaround, then they can continue. If we then find that they're not in compliance because there's either another call or that has documentation that they're not in compliance, or we're also having one of our inspectors going around doing windshield surveys, just basically from their car, checking on sites. If they see that they're not in compliance, we will shut down the site for 7 days. And they will not be able to continue for 7 days. They need to recognize how important this is. So it is allowed, it is considered essential business.
Got it. Thank you so much. I appreciate it.
All right. Thanks, Lily. Thanks, Brandy. Anybody else? Question? All right. Well,
I have a question.
There we go. Yes, go ahead.
This is for the superintendent. When will schools begin continuing with IEPs that were already scheduled and due?
We should already be addressing that. So if you can give me your name and number, that will be the first follow-up piece I have tomorrow morning. But this is the first I've heard that we are not. So please send me your information. You can go to skeller, S-K-E-L-L-E-R, at RBUSD, Redondo Beach Unified School District.org. And I promise you I will follow up first thing.
Thank you.
Thank you.
Thank you.
Okay. Anyone else? All right, well, if there's no other questions right now, please feel free to email me anytime or send me a message via Facebook or Twitter, whatever your preferred method of communication is. You can also call me directly on my cell phone. And if you have a question, I will forward it to the right entity and try to get you that answer during this time. One thing before we sign off here, I want to read something. It's attributed to Bill Gates, and I thought it would be just an interesting way to end this call, since these are times like we've never really experienced. It says, I'm a strong believer that there is a spiritual purpose behind everything that happens, whether that is what we perceive as being good or being bad. As I meditate upon this, I want to share with you what I feel the corona COVID-19 virus is really doing to us. 1, it is reminding us that we are all equal, regardless of our culture, religion, occupation, financial situation, or how famous we are. This disease treats us all equally. Perhaps we should too. If you don't believe me, just ask Tom Hanks. 2, it is reminding us that we are all connected and something that affects one person has an effect on another. It is reminding us that the false borders that we have put up have little value, as this virus does not need a passport. It is reminding us, by oppressing us for a short time, of those in this world whose whole life is spent in oppression. 3, it is reminding us of how precious our health is and how we have moved to neglect it through eating nutrient-poor manufactured food, or nutrient-poor manufactured food, and drinking water that is contaminated with chemicals upon chemicals. If we don't look after our health, we will, of course, get sick. 4, it is reminding us of the shortness of life and of what is most important for us to do, which is to help each other, especially those who are old or sick. Our purpose is not to buy toilet rolls. 5, it is reminding us of how materialistic our society has become, and how when in times of difficulty, we remember that it's the essentials that we need, food, water, medicine, as opposed to the luxuries that we sometimes unnecessarily give value to. 6, it is reminding us of how important our family and home life is, and how much we have neglected this. It is forcing us back into our houses so we can rebuild them into our home and to strengthen our family union. 7, it is reminding us that our true work is not our job. That is what we do, not what we were created to do. Our true work is to look after each other, to protect each other, and to be of benefit to one another. 8, it is reminding us to keep our egos in check. It is reminding us that no matter how great we think we are or how great others think we are, a virus can bring our world to a standstill. 9, it is reminding us that the power of free will is in our hands. We can choose to cooperate and help each other, to share, to give, to help and to support each other, or we can choose to be selfish, to hoard, to look after only ourselves. Indeed, it is difficulties that bring out our true colors. 10, it is reminding us that we can be patient, or we can panic. We can either understand that this type of situation has happened many times before in history and will pass, or we can panic and see it as the end of the world and consequently cause ourselves more harm than good. 11, it is reminding us that this can either be an end or a new beginning. This can be a time of reflection and understanding where we learn from our mistakes, or it can be the start of a cycle which will continue until we finally learn the lesson we are meant to. 12, it is reminding us that this earth is sick. It is reminding us that we need to look at the rate of deforestation just as urgently as we look at the speed at which toilet rolls are disappearing off of shelves. We are sick because our home is sick. 13, it is reminding us that after every difficulty, there is always ease. Life is cyclical, and this is just a phase in this great cycle. We do not need to panic. This too shall pass. And finally, 14, whereas many see the corona COVID-19 virus as a great disaster, I prefer to see it as a great corrector. Just a reminder of the important lessons that we seem to have forgotten, and it's up to us if we will learn them or not. With that said, I want to thank everybody who took time today to participate in this call. I really appreciate it. I realize that our staff Dr. Keller and Brad Waller, Jacqueline, Dr. Kim, Dr. Stratton, everyone involved is super busy. And like I said, this is evolving sometimes on an hour-to-hour basis, but definitely on a day-to-day basis. So I truly appreciate you taking the time to participate. I appreciate everyone who signed on to ask questions or even just listen. Thank you all so much. I guess we'll be doing this again in April, if not sooner, but I appreciate it all. And like I said, feel free to email me directly. Questions for Dr. Keller, as he just gave his email address, you can email him directly. And then we will see you all. Please stay safe, stay home, just run out if you need to for essential items only, and don't do anything stupid. All right, thanks everyone.